we found in terms of you have to be able to follow directions,
Mhm.
and we would like to have probably about 10 years old is
Okay.
probably a good place. Again, we've had people come in and say, my son or daughter is very bright, and if they can follow directions, are not afraid to do this, and can do the training, we're okay with that. We'd rather have somebody do something than do nothing.
Okay, perfect.
So
Perfect. So when it comes to CPR, is it important to how would I say when you're faced with doing CPR, is it important for you to get permission, or do you just go? Like, can you walk us through what that would look like out in the community?
sure. Typically, when this happens, I can, reflect on when I've done it in the community, and just, the three places that I've done it. Again, the person collapses, and the people around them don't know what to do. So you assess them, and when you're assessing them really quick, you can identify really quick. You shake them, are you okay? If there's no response, and you can check for a pulse, and we train you how to do that. Typically, the neck is probably the easiest way to do that. Again, the reason that you're making sure that they're okay, and not having something, they might have heat stroke, they might have be dehydrated. There's a number of reasons why someone's going to just faint. So you want to separate fainting from a cardiac arrest. And the easiest one is the pulse. So no pulse, again, you basically start. The laws in place in the United States, and every state basically has a Good Samaritan clause that basically, if you're intent based on how you've been trained to help the individual because of the assessment that you did, meaning that they had no pulse, and you tried to get response from them, it's not there, you can go ahead and do that. Um, there's very rare instances that someone will intervene and say, "Don't do that."
Right.
The only time that's happened, from what I have heard and seen in conferences and such, sometimes people will have a bracelet that says "Do not resuscitate."
Mhm.
So some people will have that, and the family members knows that. You basically have to get some evidence that that is the case.
Okay.
And typically they will have that on their person as a bracelet. So typically you're covered as long as you check the pulse, they're not responsive, you can go ahead and do what needs to be done.
Okay. We have a couple of other questions. It says, how do I know when to use an AED? And is it safe to use an AED on someone with a pacemaker?
Um, yes, yeah, yes or both. Well, basically, how do you know? Again, if the soonest you can start the AED, the better. So as soon as you get that on the patient, it doesn't take more than probably 15, 20 seconds. You can start CPR, and after a bit, you can put that on there. Some people just put the defibrillator on, because it's going to tell you if you have a defibrillator type of a rhythm, and it'll assess it for you. It'll say, keep doing CPR, or stand back and we'll take over from here. So it will, as soon as you can get the AED going, it's better. So you always want to start there, and then keep going on CPR. It's going to tell you that. That's the great thing about this machine, is that it basically, you put it on, press start, and it talks to you. It says do this, do that, and it works pretty well. The second question that you had was, if you could repeat the second question again.
Sure. Is it safe to use an AED on someone with a pacemaker?
Yeah, you can. Again, if the pacemaker is working, it's going to pace. If it's not working, you're not going to get a pulse. So in that case, it's not being effective. So in that case, it'd be okay to use it. It's not going to do anything, especially if it's not working. Again, typically pacemakers are placed for patients for a number of reasons, AFib, different types of arrhythmias. If it stops working, or if you don't get a pulse that actually produces a pump, if the contraction of the heart is not being impacted by the pacemaker, you have to do something. So sometimes pacemakers don't work. Sometimes they're not effective for whatever reason. So you're okay with that. Um, and again, it's better. Some people look at it the other side of it too. If they're not sure if the pacemaker is working, they're not sure if they feel a pulse, you do it. What will happen basically is sometimes if the shock is big enough, it might disable the pacemaker. But because you're doing CPR, someone's going to come and help. They can take care of that afterwards. Again, you don't want to go into a situation where you have a faulty or an ineffective pacemaker and just rely on that, because obviously it didn't work because the patient collapsed.
And the last question I have here is, how can we encourage? We know how important it is, of course, now after your presentation. How can we encourage more CPR education in places like schools, the workplace, and the community? How can we start promoting this? Because it is an absolutely life-saving measure.
Sure. I know our life support education center here goes to schools occasionally, like I mentioned before. We typically will check with the school districts if they want to learn that way. It depends on what their schedules are like. In the past, we've contacted community centers, churches, and doing things like that. But your own knowledge helps. If you're hearing this and it's something that you think would help you, your family, people around you, give us a call. We'll be happy to help set you up on that. And word of mouth is usually the best. It's not as scary as people think. Working on a mannequin for the first time is always easier than working on a person for the first time. So it's important. Just doing it word of mouth helps the best, but it's a combination of all of those.
Absolutely. Well, Dr. Lopez, thank you so much for being with us today and talking about this extremely important topic that absolutely can save lives. Thank you for your time today. And I want to thank our audience for joining us today. Thank you so much for being our live audience. If you are not watching us live, please know that you are welcome to look at any of our videos on demand here at Wellness Live. And I want to invite you to next month. Will be July 31st, and we are in 2025. And it will be Kim Kinney will be our next speaker, and she's going to be talking to us about what is workers' compensation. So if you've ever been on the job or know someone on the job who has had an injury, she will tell us about workers' compensation, what it is and what it isn't. So we hope to see you next time. My name is Dr. Olivia Moses, and wishing you happiness and wellness.